right, everybody, welcome. Thank you so much for joining us for another World Spine Care quarterly meeting for our growing community that we call the Backbone. And these are generous donors who contribute to World Spine Care and support our work of bringing evidence-based, hands-on spine care to people around the world who are most in need. I'm Nathan Cashin. I'm the Director of Communications for World Spine Care, and so pleased to welcome everybody today. Want to give a shout out to especially all the members of the Backbone and donors who are joining us today, those of you who have committed to donating, and other members joining today who are board members and others involved in World Spine Care. So thank you so much for participating and being here. We are so excited to introduce our newest clinic supervisor, Dr. Rolene, who is going to be starting up a new clinic in South Africa and has also been part of founding our newest organization, World Spine Care Africa. So we're thrilled to be sharing this today. This meeting will go for just under an hour. We'll have a little bit of introductions, a little bit of just instructions on how things work here. And I want to reflect a little bit on what's brought us to this point, and then we'll have a nice chat with Rolene all about World Spine Care Africa and the new clinic. And then we'll have some time for you to ask any questions. By way of just kind of how things work in here, I really recommend that you pop in, let's see here, and change your settings so that if you haven't done it yet, I want you to open things up full screen because we'll be having a few photos that we'll be sharing. We'll have Rolene and others joining us, and it's a much better experience if you open it up in full screen if you can. And would really love you to join us on screen as well by turning on your video if you're able. We want you to be part of the conversation and part of this event. And by doing so, we can see who is joining us on this call. So we'd love to see your faces, love to have you as a part of this. At any time, if there's something that you love, go ahead, drop a reaction down below, and that'll come up on screen and let us know that there are things that are interesting, and we might carry on talking about that. If you want to send a message without coming on screen, then you can just drop it down in the chat. Now that everybody's here, I'd really love to see where everyone's joining. So go ahead and open up that chat, and if you would, please type in where you are joining us from. Type in a city, a country, anywhere around the world. I would just love to see where everyone is coming from today. I'm going to pop in where I am. Of course, a few from South Africa. We've got, is that somewhere up in Russia? Okay. My geography isn't the best, of course. Down in Florida, I see. Let's see where else. We might be cutting off. David Chapman Smith, I can't remember if you're up in Canada or if you're down in New Zealand. It looks like we've cut off New Zealand. So sorry about that. There we go. There's some in Canada. That's awesome. Thank you guys for joining us from all over the world. It's so wonderful to see this community spread out so far. And it's nice to be able to come together and participate in things together. So really appreciate you being here today. Before we begin, I thought it would be appropriate to kind of do a little recap on where things started and how we got to where we are today. So most of you probably know World Spine Care was founded in the U.S. around 2009, and a couple years later, the first clinic opened in Botswana, first in Mahalapi, and then the next year we opened up another clinic in Shoshone. And World Spine Care Canada was also founded that year. A couple years later, we opened the clinic in the Dominican Republic. Then World Spine Care Europe was founded in 2016, and the India clinic was opened. I was privileged to be able to go there for that opening. Then we opened a clinic in Ghana, and around 2020 we opened the BH3 clinic, which was another clinic in Botswana, in Gaborone. and just a few years ago opened our newest clinic in Cross Lake, northern Manitoba, on the Pimicikmak Indigenous community. And that brings us to today, and we're so excited to continue this timeline because over the past, what has it been now, about 15 years, we've opened 7 clinics in 5 countries, and in those clinics, over 70 volunteers have provided approximately 70,000 treatments to patients who otherwise would have struggled to find relief from their neck or their back pain. And today we get to add to that, so now we have 8 clinics in, is it 6 countries, if I'm doing the math right? So that brings us to 2025, and we're so excited to see what happens in the future. And today we get to talk about the founding of World Spine Care Africa and the opening of our newest clinic in South Africa. And to help us learn more about this, it's my pleasure to introduce our newest clinic supervisor, Dr. Rolene Rademan. Quick bio for Rolene. She obtained her higher certificate in music from the University of Stellenbosch in 2013 before completing her master's degree in chiropractic at the University of Johannesburg. And she and her husband, Ruben, who's joining us today, established their private practice in South Africa, where they continue to serve the community with a strong focus on equitable, evidence-based care. And since 2023, Dr. Rademan's been involved with CASA, the Chiropractic Association of South Africa. She's deeply committed to promoting community health and expanding access to quality spine care services, which, of course, you'll see evidence of today. Rolene, thank you so much for joining us today.
Thank you so much for having me.
Well, I'd love to just hear a little bit more about you and how you got into chiropractic and serving people in need. What was the impetus for going to chiropractic school?
It really started when I was in my final year in high school. I had a very, very minor injury that would have been something that typically would have been overlooked. Problem was I couldn't stand on my foot, and it was so painful. It took months of specialist care, specialist tests. No one could really figure out what was wrong. The pain was excruciating, and it ended up with me, after all of these tests, they just kind of gave up and said, well, we don't know what's going on. You've got swelling in your foot. You've got pain in your foot. It's going cold. Let's just put you in a moon boot and see what happens, and let's just hope for the best. So after about 6 months of not being able to walk on my foot, I eventually got the moon boot, and I had to go to the chiropractor because now I had low back pain because the moon boot's like quite a bit elevation compared to the other foot. And the chiropractor gave me one look, and he just asked me, why am I in a moon boot? And he just said, well, take that thing off. He gave me an adjustment, and he was literally just telling me, well, get up and walk. And that was the first time in over 6 months that I didn't have pain. So that's the day I realized that, I had a very big interest in medical, in a medical field and healthcare and so, but I didn't know what I wanted to study exactly. And after that day, he just opened my eyes to see that we rely a lot on imaging and on specialist referrals and all these things, but we sometimes forget to just look at the very basics and look at the body. He was the first person to actually look at my body as a whole and not just a part of me. And that's how I just fell in love with chiropractic and how it completely changed my whole perspective about it. So I knew I wanted to study chiropractic, but I wanted to finish up my music first, and just felt that I needed to, after 12 years of piano lessons and many years of flute as well, I wanted to finalize that a little bit. And then I went to the University of Johannesburg, did my many years of studying there. I ended up meeting my husband there as well. He's also a chiropractor. So it was a very long but rewarding journey. And when we finally got to our final year, we ended up in COVID. So our clinic shut down. We had to completely revise our master's degree, our thesis, and it took a little bit longer to qualify than it should have. We had a lot of trouble not only finishing our studies, but also completing our patient numbers. And then we had to find work, which was very difficult. Most of the people really didn't want to employ associates or locums. They were having trouble just keeping their doors open. And because we're two chiropractors that are both looking for work, we really needed a good solution. So we were supposed to, we wanted to have work experience of working for someone else, just finding our feet, and then hopefully we would have the opportunity to go overseas, so that we can maybe work in Europe and study further and get to see the world a little bit. But things didn't turn out that way exactly, and it was definitely for the best. We ended up in a very small town called Hoedspruit. It's in Limpopo, in the northern part of South Africa. So I grew up about 180 kilometers from here, which isn't that far, but I hardly really visited Hoedspruit. So it's a very rural town. It really is mostly for tourism. We're very close to the Kruger Park. So it's mostly for tourism. We've got a lot of foreigners that stay here for about 3 to 6 months of the year. And then another big industry is the citrus and farming industry. So moving from Johannesburg, we fell in love with this town because it's so small. We don't even have a traffic light. We just have stop signs. So it really gives us, compared to the rest of South Africa, we felt safe, we felt free, and we felt like we could have a life that, there's something worth building here. So we took the plunge, and within a month of deciding to open our own practice, we opened our own practice, and we actually just started the work. And even from the day that we moved here, we knew that there was something more we wanted to do. We wanted to be able to serve the community a bit better, but we also realized that we can't offer free services in our private practice, and we can't offer the services for everyone at a discounted rate, because then at the end of the day, we would just be the ones losing out, and people take advantage of that. So it took us a long time of working on the idea of how we wanted to structure it. We had the opportunity to volunteer with Hlokomela, which is the clinic that we've opened and partnered with. But we realized also that just volunteering doesn't really suit the idea, and it doesn't really provide a sustainable practice. So we needed to be sure that if we do this, we need to make it sustainable. We need to make it beneficial for the chiropractic community, for the profession, and for us also to be, feeling like we're benefiting the community in a better, bigger way. So we wanted to basically just make it a little bit stronger. And so Michael, he's on the call here. Michael and Ruben is my husband. They used to be, they're very good friends. We all studied together, and they used to be flatmates, so really good friends. So Michael started with World Spine Care a few years ago. He volunteered at the Botswana Clinic. So he, gradually told us a little bit about what he gets to do, what he sees, what his experience is with World Spine Care. And one day it just, the light bulb moment just hit. We just realized that we're looking for something or an organization, or we need backing, and we need the, the bigger name behind it in order for us to make this idea we have sustainable. We have the place we want it to be. We have the people that, need to do the work. And we approached World Spine Care, and we had a meeting, and we said, you know what? We have a clinic where we get to work at. We have all of the equipment that we need. We're willing to volunteer for 1 day a week, and we don't want any money. We don't want anything. We just really want your name to be able to say that this is evidence-based. It's got a reputation behind it. And we want to be able to collect the data in a way so that it's usable for research, because that is a very important thing for us. Is we want to make data accessible so that we got a local demographic, real, tangible, evidence-based things, so we can use in South African demographics. But that actually made things a whole lot harder. People got really scared when they heard that there's no money really to be involved. And Scott, the first meeting we had was, his biggest concern was about the sustainability. And after many meetings and many discussions, we got CASA involved as well, the Chiropractic Association of South Africa. So as we got more people involved in the conversation, we soon realized that there's a lot of support and the need is really big. So the more people came on board, the bigger the project grew. And as you now know, we've got a clinic standing. We've got a clinic that we're running full-time, 5 days a week. And yeah, we are officially having our opening next week on Wednesday, on World Spine Day. So
Very
it's been a
exciting.
it's been a very long journey. And there's a lot of people that have played a role in this and grown it to the concept that we have it today. And I'm really thankful for that, because without all of that support, it wouldn't have happened. I mean, we would have stayed with the idea of a very small volunteer group, and it's not beneficial for the community at the end of the day. And that's what we aim to do, is making sure that when the community gets the care, they actually get the backing behind it, and they understand that, you know, it's not just two people trying to change the world.
That's amazing. It's such a great story and a great motivation behind getting involved, and really glad that you were able to connect with Michael. Um, clearly, there's many people involved in this. You've mentioned some of the partners that you've worked with. So, Hlokomela is the local uh, clinic that's already been established there, and Chiropractic Association of South Africa. Tell me a little bit about how they've been involved and what different things that they've done.
Right, so Hlokomela is a local clinic. It's a private clinic. It's not a government clinic. They've now just celebrated their 20-year anniversary. So they started
Mhm.
with one nurse or sister that she saw the need for the community that needed care, the farm workers especially. So that's the logo that you see. It's the healthcare worker extending the hand to the farm workers. Um, there was such a big need many years ago. They started their programs to provide AIDS and HIV treatment. They grew very quickly. They expanded their reach tremendously. Over the years, they've now developed programs for the HIV testing treatments, STDs, worker programs. They've got a baby clinic. They've got a women's clinic. They've got 3 base clinics, and then they have many mobile sites that they also visit. Um, what they basically do is provide primary care. So it's a nurse-run practice, and they offer all the types of screenings that you can basically think of. And then they've got a great support system with them as well, which makes them successful. And that's the reason that they've been able to be open for all these many years. They've got partnerships with great medical aids, also with the government, so they get some subsidies from different avenues. And they also have a very interesting payment system, which makes it very accessible and cheap enough for people to actually afford it, and also then get the appropriate care that they need. So I was inspired by the way that they actually, got to serve the community, and the way that they got to do it was just in a completely unconventional way. And that's just kind of what inspired the whole idea about how to grow and not just be a solo person in silo. Get a bigger community behind you to make it sustainable. And thanks to my work, my opportunity to work with CASA as a chairperson for the local branch, I also got to know CASA really well. They've been very supportive in our private practice as well, because that's essentially what they do, is they offer the chiropractic community support in many different ways. And over the years, from the needs that we've had, I've gotten to know some of the members there, and we got chatting once about this idea that we had and that we want to involve World Spine Care. And yeah, that was, I think, 2 years ago at the Johannesburg Congress. I think I was the first time I mentioned it to Bridget. And this year we have our opening. So we're really excited to be able to share it with them. They've been really helpful in helping us, getting the right connections, getting sponsorships, getting donations, creating awareness under the chiropractic community in South Africa was absolutely wonderful. And they've very generously hosted a charity auction for us now at their latest Congress, where they've raised a lot of funds for us, which is absolutely amazing. And anytime we have any problems, I just raise my hand, and Dan is always there to help us out and at least point us in the right direction if she doesn't already have the answer. Then we also have a partnership with the Spine Society of South Africa. So they're also, spine specialists. It's a range from chiropractors to surgeons to all types of different surgeons, really. And they're there to offer us support in advice and things like that. And we're working on developing a better referral network for the northern parts of South Africa, because there's a big lack in that. Unfortunately, we didn't really have our private, or our government institutions don't really have what we need in terms of referral pathways. So people have to travel really far to get specialist spine care. And at the end of the day, they just have it's really sad, but it's a typical understanding around here that, if you get really ill and the ambulance comes to get you, which typically happens to people when they get really, really bad pain, because they can't walk to the clinic or whatever, they just accept that as that's the last time that they'll see that person, because typically they end up going very far away, and they unfortunately pass away a lot of the time. So yeah.
Oh, that's sad to hear. It seems that partnerships have really been such an important part of World Spine Care, working together with other organizations on the ground and in the communities. So it's great to hear that that has been a big part of starting this clinic. And I do hope that we can get that referral process improved. It reminds me of a project going on in Australia right now. That they're relying on telehealth consultations to be able to do that type of work. So look forward to hearing what you'll be able to come up with. Remind me, when was it that you were able to sign the agreement with Hlokomela? I do have a few photos here. Perhaps you can chat about that.
True. I'm really not good with dates.
That's all right.
So the concept about the World Spine Care Clinic started about 2 years ago. And last year in February, we went to visit the Botswana clinic. So we got to visit Michael and Mufutsi, just to see how their clinics operate and to make sure that we understand that, the concept we want to apply is similar and that we comply with World Spine Care standards. And then in March, I believe it was March last year, we had CASA visiting us. And they also assisted with just making sure that we're on the right track, getting the right connections. And we had the agreement signed earlier this year, and I can't tell you exactly which month it was. My husband's the one that remembers all the dates, to be honest with you. There's been a lot going on this year. We've been working on that agreement for a very long time, though. And it's one of the reasons why, we're only getting to open now, because originally when we pitched the idea 2 years ago, we were like, let's just open. We don't have to jump through many hoops. And thanks to all the partnerships, they've made us realize, once again, sustainability, making sure that we comply with the right legal structures and all these things. We need to have a proper agreement. Oh, thank you, Michael. It was in June. We got the signing and done in June. So
Thank you,
June, our
Michael.
directors came and we got the official documents signed. And in, let me just think now, July, we'd started on the construction and everything. Yeah.
Great. I'd love to talk a little bit more about that. But Michael, if you don't mind me putting you on the spot, you can join us too. You want to share anything about your involvement in getting everything started?
Yeah, I think firstly we should just kind of say a very big well done to Rolene for all the work that she's done. It has been, like she said, a 2-year process. One sometimes goes into a project not quite knowing how much legal paperwork and MOUs and terms of references, and coming out of chiropractic school, we have no frame of reference for that type of legal talk. So yeah, just a very big well done to Rolene. Over the years, many people have tried to set up a clinic in South Africa. There's been talk, there's been efforts. But yeah, she made it happen, and really all that it took was someone to put up their hand and say, I want to do it. I want to do something. And the community just backed that person, from South African Spine Society to Hlokomela to South African, the Chiropractic, CASA. So yeah, just a big well done. But yeah, like Rolene said, I've known Ruben and Rolene for about 10 years. Studied with them, went through the whole chiropractic program. And yeah, just a big well done. They've really been able to reproduce the values that World Spine Care has and the things that they prioritize clinically. They've really been able to translate that into a completely different culture, completely different setting from many of the other clinics.
Wonderful. Thank you so much for sharing your thoughts there. I'd love to hear more about where the clinic is, and you've talked a little bit about the surrounding areas. I have this little map for those of us who are geographically not inclined. So it's up in the northeast of South Africa, pretty close to Botswana, I think. Is that right?
Yeah, we are quite close to Botswana. To be honest with you, if we get in the car and drive right now, it's the same time we travel to, or it's approximately the same time traveling to the clinic in Botswana where Michael is at, compared to actually driving to Johannesburg. So we are about, I believe it's about 6 to 8 hours of good driving.
Okay, so it is quite rural.
Yeah, we're very. I mean, like I said, we don't even have any traffic lights. Our closest town, or if you want to go big shopping, is about 120 kilometers away. So thanks to online deliveries, it makes the world a lot easier, though.
That's very nice. Now, you know this, but I don't know how many others know. My wife is South African, and she speaks Afrikaans around the house to our kids. And so I hear the language and can understand it. But when I see it written, I really still have trouble trying to pronounce. So if you could, for all of us, please help us pronounce. I've seen so many different versions. Hoedspruit, Hoedspruit, Hoedspruit. And I think it depends if it's more of the Afrikaans or the English pronunciation. So
Yeah, so it's
if you
Hoedspruit.
would please. Great.
Hoedspruit
Hoedspruit.
meaning like hat creek, basically.
Yes, I was reading about the story that the original farmer lost his hat in the creek, and I guess that's where the name came from. Yeah, Scott has gone on and on about what a beautiful area of the country it is, and you've mentioned a few of the things. I do have some photos here that I just pulled off of the internet from a particular photographer. Um, what are some of the highlights of the areas that people might want to
So
see or visit?
what makes Hoedspruit so popular is really the tourism attractions. We are very close to the panoramic route. We're about half an hour's drive to the Kruger National Park. We're surrounded by big 5 game reserves. So, safari's very big, camping very big. And then we've got this beautiful mountain range, which is the end of the Drakensberg mountain range. And if you travel to that mountain, and we just did the trip up the mountain again this weekend, it's so beautiful because you drive through this absolute dry bush veld. It's very dry right now. We haven't had rain since our summertime, and then you get to the bottom of the mountains where it gets a little bit greener. It gets very rainforest like, and then if you drive up Mariepskop, which is the highest point of the mountain, if you drive all the way up, you get to the top where it's like fynbos, which is plants that you typically see growing in Cape Town.
Hmm.
It's a very, very diverse ecosystem, or many diverse ecosystems we have around here. It's a stunning area to be in, and there's a lot to see around here and a lot to do. It's rural, but it keeps you busy if you're an outdoorsy type person.
And you mentioned some of the animal reserves, and obviously the wildlife appears to be quite impressive as well.
Oh, so much. I mean, we've got warthogs roaming the streets regularly. That's what Hoedspruit's known for. So everyone has these warthog stickers on their cars. We've got the leopards walking in the neighborhood, so our pets aren't allowed outside at night. And that's in town, that's not just on the estates or so. We've got, yeah, we're very blessed to have all of this wildlife around us, and you get used to it really quickly. And it makes you slow down because, you know, just life in general, you need to slow down because you always need to be aware of the hippo that might be actually running into the road. So, yeah.
See, I lived in a rural town and it was a deer that I had to watch out for. I mean, maybe a cow, but a hippo, that's something completely different. Well, thank you for setting the environment or the area where the clinic is. And I'd love to hear about the clinic itself that's been built up thanks to some funding from a local foundation. And you know, how did you get through this process? Because obviously there were some challenges with this too.
Yeah, so like I mentioned, you know, originally starting, we had the agreement sort of with Hlokomela that they were willing to let us have one of their rooms, you know, 1 day a week because they have visiting doctors in general that go there. But, you know, that would have given us some difficulty with equipment, and it wouldn't have been sustainable if we wanted to bring in big equipment and have a permanent bed in there. So over the years, as we've talked about, and I guess over the years as World Spine Care has vetted our interest in this, they realized that we're not backing down. We're not letting go of the idea. Scott got a great great donation for us. So the Lingham Foundation has been very generous and donated a large amount of money for us to be able to set up this clinic. So it gave us the opportunity to put up a container clinic. So it's a container that's converted. We've got insulation in there. We've got a solar system up that provides us, you know, independent electricity. And as you'll see on that larger picture, that was what the site used to be. So that's right at the entrance of Hlokomela. The clinic itself is on the right-hand side of that image. And what you're looking at right now, yeah, that's where the container stands right now. So we had our foundation walls built. We had our container converted, and it was a big process deciding how we exactly wanted to make this work. So the video you're seeing right now, the most stressful day of my life. We had our container delivered, but unfortunately the truck, that specific truck, couldn't unload it on the place that it should have been. So they had to bring in another truck and load the container again. And then they had to, you know, actually place it really well and secure it all the way again. And actually seeing that happen, you know, I mean, this is a 12-meter long container. It's absolutely huge. And you'll see how that truck just tilts to the one side. My nerves were shot, you know, just what if it damages the container? What if it damages someone else's property? And then what? Then you don't have a backup. So yeah, we had this wonderful sighting that was absolutely wonderful. It took them, I think it was about 4+ hours to actually deliver the container and place it correctly on the right spot. So they had to bring in this crane truck, and it took them so long. So it was little by little that they maneuvered it in the right place. And it's absolutely amazing seeing these people work. I mean, they are so precise. There was a time where actually right here, where they've lowered it down, where it's so narrow there. And I'd squeeze it in because we didn't want to cut down this tree. We already trimmed it by then, but we need to be also very conscious about the fact that it regularly gets above 40 degrees Celsius around here. So we need to keep as much, you know, shade and secure isolation as we can. Solar system installed, which gave us the opportunity of not being reliant on anyone else for electricity. And we had the awning installed in front for a waiting area for the patients. We had that paved as well. And it all took quite a bit of time. But this is just, yeah, a nice view of what the container is like inside. So you'll see, very important, the aircon system, because without that you cannot function. And so we've got 2 rooms and a central area for a reception.
And you have solar as well for the power?
Yes, yes, because
Wonderful.
South Africa does have some issues with electricity. We just
Yes,
figured, you
I've
know,
heard.
to make sure that we actually get to offer services on a constant regular basis. We had the opportunity and we got a discount rate as well. So we were very fortunate with that. So that is shortly after it was, everything was built and put up. So we use the front side also for some exercises and educational programs and things like that. We'll see how it goes in summertime. I'm sure people will be eager to do the exercises very early in the mornings and then rest for the rest of the day. But yeah.
Wonderful. That's amazing. It's so exciting to see that. What's coming down the line? You've got the grand opening next week. Any other future plans, and what are the next steps for the clinic and for World Spine Care Africa?
So many plans. We have so many plans. The reality is just we need to be, we need to make it work. We need to make it sustainable, and we need to get the work done. So after the opening, we're having our big opening, yes, like next week, like you said. We're unveiling it to the community and making sure everyone knows exactly what we have to offer. Then we're going to focus our efforts on education. We've already been seeing some patients a little bit, and we very soon realized that, there's such a big need for education and just understanding where a lot of the issues stem from. If people can just make small lifestyle changes, it can really make the world's difference. And we've already seen what a big impact that has. People just need some guidance. So we've been working with what we call the Nompilos, which are essentially community health workers. So they are people placed, they're farm workers, and they basically represent the workers, the other workers on the farm. So they will be, liaising with Hlokomela, and when they hear someone cough, they will advise them and say, that sounds a little bit, it doesn't sound great. Maybe you should go to the clinic and just see the nurse. So we've been working with them for a few months now, educating them and telling them what we have to offer. CASA's also conducting a research study right now, which focuses on what the community understands mainly about chiropractic. So we really want to expand our reach just in terms of building the community understanding so that they can, spread the word and also teach people on a few basic exercises. And if that doesn't work, then you need the clinic. So we've also been to a creche to educate the educators and the caretakers and also the kiddies at the same time. We can't, it's right now it's just me and the assistant. We're just two people. We can't change the world, but if we get to educate the people, to teach the children to do the right things, that's going to be the big difference we need for the future. So that is a very big passion of mine, is making sure that the children get the care that they need. So we want to, like I said, education. Another big focus for us, because we have such a big citrus industry and a lot of farms around us, we want to really expand our reach into the pack houses, the farm workers, the people that pluck the citrus, all these things. It's very labor intensive and it's very hard on the bodies. And these people typically work on a concept of no work, no pay. So if you can't work, you get no money. It's all seasonal workers. So it really makes such a big, it impacts them so deeply. So if they could just improve their general productivity, that would be great for the farms and it'll be great for them as well. So we've already had a lot of interest from these pack houses where they pack the citrus and the mangoes and all these things, and the bigger game lodges as well, because productivity gets affected so much, and they really have very high standards for these things. And unfortunately, it's not something that they set themselves. That's international expectations and standards that they have to keep up with. And if people don't make the cut, they don't get, the job again next year. So, I think for that part, we're going to start basic and small and just start the educational programs. And hopefully next year sometime, Michael will be able to join us so that we'll have more hands on, more feet on the ground, more hands available. We'll have more opportunities to do hopefully mobile clinics as well, because there's also a big interest for that. A big problem with the tourism industry here is people work 6 weeks on, 2 weeks off. So for 6 weeks, they're basically trapped on the reserve or the lodge or wherever they are working. They don't get to travel to town. And when they have 2 weeks off, it means that they go home. And that might be to Johannesburg, to other towns far away where they don't have necessarily access to care. Even if they do have the funds for private care, just 2 weeks for treatment doesn't really make a difference to that 6 weeks of abuse, basically. So if we can do mobile clinics, that would make it at least a monthly type of treatment, and once again, expanding just the educational base. And then there's also a lot of interest for research. So for that, we just want to build our database and make sure that all the information is captured correctly, so that when there is someone that wants to do the research, it's easy to do, it's easy to apply. There's already been talks about about more clinics in South Africa, but right now we just want to figure out what we're doing, how we should be going on with this, and how to give the best affordable care, but also just making it accessible and making sure that people understand. I'm not sure about all the people on the call, but I know from our perspective, we're chiropractors. I'm a chiropractor. My husband's a chiropractor. And the Chiropractic Association of South Africa also has such a big interest in this. It's just the effect that this clinic can have on the perception of chiropractic in South Africa is such a deep passion for us, because typically chiropractic is described as a cost-effective treatment solution. But that's only if you really compare it to surgery or other, more invasive types of treatment. And the problem is that, we see that there's such a need for people that need the care, but they can't afford it. And then they come to you, maybe they've saved up, they come to you at private practice, they come once. But the problem is, once isn't enough for them to buy into the treatment always. They don't have the time to understand what you fully have to offer. So at the end of the day, this clinic's not just about, for me personally, it's not just about offering the care to people in need. It's also about explaining what chiropractic has to offer to the bigger community. And right now, our healthcare system in South Africa is changing. It's changing drastically, and it's changing very soon. We're going into a national health NHI system. And for that, we have the opportunity as chiropractors to be included in that. But for us to do that, we need to prove to the government that, we have something to offer and that we have a place in this system. So very passionate about that. And we really want to use this clinic as the opportunity to prove that we have a place and we can make a difference.
Wonderful. Rolene, thank you so much for sharing all of this amazing information about World Spine Care Africa and about the new clinic. We look forward to seeing everything that you and Ruben and Michael and Kaza and everyone else involved are able to accomplish. I'd like to move into some Q&A. And so to do that, I'd like you to share any questions that you might have. You can, again, if you'd like, just drop them down in the chat. Any questions you have for Rolene. If you would like to come on stage, and if you've got your video on, then you can raise your hand and I'll bring you up so you can ask questions. But before that, I'd like to try something new here, which is that I'd love to get a photo, but it looks like things aren't quite working how they're supposed to. There we go. So if you will indulge me, everyone strike a pose. We're going to take 3 photos here in a row. Big smiles, big waves, anything you'd like to. Here we go. 3, 2, 1. Say Hoedspruit or Hoedspruit or whatever it is. All right, and you can download, I sent a link here in the chat. Let's see if that's going. There, you can download those photos and share them around as you would like. So thank you for that. Let's see if we've got any questions. We'll move on to a Q&A here. Let me just bring any questions that we might have. I will start us off, Rolene. And let me just bring you back. We've heard a lot of questions as news about the clinic has opened up and spread around. So one of the obvious questions, will there be opportunities for chiropractors to volunteer for abroad? What will the volunteer program look like?
Yes, so definitely there will be an opportunity to volunteer. We are working with the Allied Health Professions Council of South Africa, which is the regulatory body for chiropractic in South Africa. We're working with them to make sure that chiropractors can qualify, or if they meet the criteria, they can register for a temporary registration, and that would make it legal for them to register or practice here. And for that, I mean, with all the things that you need to do, you need to, I believe we'll work on the same system as World Spine Care in general does, where your minimum volunteer period is typically 3 months. So we're working on our volunteer programs, and that is something that we'll be paying more attention to now once the opening is over. And once we also have a little bit better idea of what the needs are of the clinic and what we can, how we can expand our reach. But we definitely are going to be open to volunteers from abroad, yes.
Great, thank you. David Chapman-Smith has a question here on, do you have time and space for your piano?
I hope my husband hears this. So that's a very sore spot, actually. I haven't had the opportunity to move my piano to my home yet. And unfortunately, no, I don't have the opportunity. I do have my flute with me at least, and my daughter really enjoys us playing all types of noisy things together. So yes.
That's very nice. Let's see, another question we had submitted before, Dr. Ventura. What's the best way for DCs in practice to support you?
That's a very good question. It's a question we've been thinking about now for a while. And right now, our biggest need really is just to make our clinic known and financial support. Even a little bit of support goes such a long way. Because we've been so fortunate of having a private donor for our setup, we've also been very fortunate to get some donations for running the clinic. But we need to make this sustainable in the long run, and at the end of the day, every little bit of a donation goes such a long way. So we have our donation portal that Nathan's set up for us, which is absolutely great. Right now, we can't accept international payments, which we're trying to sort out, but that's going to take a few months. So our funds typically go through Jean from World Spine Care. She then just transfers us the funds. We're working on some ideas from, even for local chiropractors to make our clinic known in a way that you could put up a poster in the front of your clinic saying that we support this clinic by donating a percentage of our funds or whatever the case might be. And then in that way it shows that you as a chiropractor you care about a bigger image than just your private practice and growing your private practice. It also provides a little bit of exposure for World Spine Care. And at the end of the day, we hope that people get to see that the work we do is not just about going into the communities, but also showing other people that, the people that aren't necessarily affected directly by this, hopefully they get to see that there's a lot of options to, reach out into community. You can contribute financially, you can contribute just by putting a poster up or just making World Spine Care a little bit known.
And we do have a page set up. We still have quite a bit of work to do, but you can go to worldspinecare.org/Africa to see the beginnings of the page for World Spine Care Africa. And there is a donate button. So if you are in South Africa, then you can make a donation, and we're hopefully we can get that opened up to anywhere around the world. I have not quite a question, but a comment from Danella. Danella, do you mind if I bring you on stage? Because you're...
Hi, everyone. I'm sure you can all read whatever written in the comment section there. But as Rolene mentioned, we first heard about this idea back in 2023 at our Congress, where it started really as like a speck of an idea, and it's just grown into this massive, massive, mammoth project. And I can honestly say, as an association, we are so proud of you and Ruben and Michael just forging ahead with this idea and just making the most of everything that's been thrown at you guys as well. And I know at times it's been pull your hair out, stomp your feet, try and figure things out, but you've just persevered. And I'm honestly so excited for the project to be replicated across the whole of South Africa, considering the juncture that we're at in South Africa with universal healthcare and national health insurance coming on board. It's just, I'm really, really excited and can't wait to see this go throughout South Africa and hopefully throughout Africa more so. Thank you.
Very kind of you to say and share that. Thank you so much. We have, let's see, a couple other questions here from Dr. Ventura. Have you established a referral relationship with the primary care providers of Hlokomela?
Yes, we have. They've got a complex system internally to also, well, I'm saying complex, but it actually makes it a lot more effective for the patients. So the patients don't necessarily have unnecessary referrals. So we are planning on integrating with their system more fully next year. But we have a good understanding of what their system is like, and more than that, we also have, thanks to the opening, we also have some connection with the local government hospitals in the area. So we're building the relationships with them, and we'll get to discuss next week, you know, what our needs are and what they have to offer, and we'll take it step by step from there.
Great, thank you so much. Don't see any other questions, so I just want to have a final thank you to everyone involved. Michael, if you don't mind bringing you up on stage, and I know Ruben was perhaps around but not on video right now, so thank you to you both for all the work, and for everyone else involved, all the organizations and partners that you've worked with. And there we go. Hi, Ruben. Thanks for joining us in the background there. Good to see you. So again, you can go to worldspinecare.org/Africa. Over the next week or so, we'll be adding more information. We will have a clinic page where you can learn more about that. So again, thank you, Rolene, so much for everything and for joining us today to share more about this wonderful new project. And thank you everyone else for joining as well. We will be doing a couple more of these Backbone quarterly meetings. We missed a couple, or probably one over the summer, but we've got a couple lined up for the next maybe 6 months. Just got to confirm some dates. So keep an eye out on your emails, and thank you again for everybody contributing and supporting World Spine Care, whether via donations or just by being part of this project.
Sorry,
And
Nathan, if I might jump in.
yes, absolutely, please.
I just want to say thank you so much. There's so many people that I really do want to be thanking. There's a very long list. I just do want to say thank you so much, first of all, to my husband. He's been really, really supportive and very patient with me of growing this idea. Thank you, Michael, for your, your input and always taking the call. Thank you, Danella, always taking the call and having an answer for me. Nathan, you've absolutely been amazing as well. There's such a long list of people that I really want to thank, and there's no way that this clinic would have happened without the help from every single person that's been contributing. But I also do want to say thank you to everyone that's on the Backbone and supporting the Backbone, because just every single person that contributes in any single way, just being part of this community, it's really inspiring. And it helps give the people that, sometimes, like Dan said, you want to pull your hair out at a moment, and then you get the support from people like this, and it just gives you the energy and the willpower to continue. So everyone really contributes in their own way. Thank you.
Wonderfully said. Again, thank you all so much for being here today. Really enjoyed it, and we look forward to seeing you at the next one. We'll see you. Bye-bye.